Hey guys, this is Dr. Samir Islam. I want to thank you for joining me tonight. So tonight I'm actually pretty excited to talk about this topic. There's been a lot of things in the news about the risk of gastric cancer and the use of these proton pump inhibitors or these acid reducing medications. And tonight I want to talk about that and see, what are those risk factors? Is this something you should worry about? Is this a legitimate claim or not? And you're going to see more and more of these studies coming out about the risk factors of the use of PPIs and the other issues that could occur with them. Things you may have heard about in the past, the risk of Alzheimer's, stroke, kidney disease, and I'm sure in the future we're going to have more and more studies to show some possible relation between taking these medications and the risk factors for developing other medical problems. So today's video, I want to actually discuss this and to talk about this particular study and is this risk factor for real or not. And so the story is that in this year, in October, there is a study that just came out which showed a possible association between long-term use of PPIs or proton pump inhibitors and the risk of developing gastric cancer. It's published in one of the big journals in gastroenterology called Gut. And this got a lot of media press, which you may have seen about this possible risk factor for being on long-term PPI use. And so let's dive into the study just a little bit to explain exactly what the authors said and seeing if these claims are true or not, or if it's something that you have to worry about. And so what this basically was a study done in Asia, and this is a retrospective analysis. So basically what they did is they got a group of patients together and they looked back in the chart or in the medical history to compare some of the different different factors within these populations. These groups that they studied were not matched. So for example, you didn't have somebody who matched exactly with somebody else when you compare the two different people. And that's what you try to do in these studies, is that you try to match one group for another. So for example, if you're trying to study diabetes, you try to find one diabetic person and match them with another diabetic person who's very similar in as much characteristics as you can. Sex, age, medications, obesity, things like that. And that's what we try to do in a regular randomized controlled trial. But this is a retrospective study, and so the study was looking backwards behind the data, and the people who they're comparing were not matched. So they were not compared between one group or another. They were dissimilar groups. And what they found in this particular study was that in those patients who were treated for H. pylori, which is a bacterial infection, they thought there was an association with a higher risk of developing gastric cancer after a long-term course of using these PPIs or these proton pump inhibitors. They found this risk to be substantial according to their paper, which is how they got the title of the possible risk of PPI use and the risk for gastric cancer. Now, when you look at the study, there are a couple of things that bring some questions to our mind and when we read papers like this. So number one, I mentioned before, is the retrospective analysis, and number two, the groups that they studied were not matched. So they're not similar, so it's really hard to compare apples to apples. They're mainly comparing apples to, say, peanuts or things like that. It wasn't a very direct analysis. The other thing too is that it was not a randomized controlled trial, and this is what we try to do in medical trials, is that we try to have a hypothesis, we have a theory, and we test that hypothesis in the future. And so let's say that I have a hypothesis that my hand will turn red if I put it on a fire. Well, that's my theory, and then we have that theory. We test that hypothesis to see if that will come true or not, and we compare that to something against that. So, for example, me not putting my hand in a fire, and that's how we typically try to do a randomized controlled trial. This was not that case. This was not a randomized controlled trial, and so it's very hard to get good data behind this. The other thing that's very important about this as well is that when you have studies like this, it's very hard, especially if it's not a study that specifically is trying to answer a particular question, to really interpret what these results mean. There's a lot of co-founders that can go into play with these particular type of studies. So for example, number one is that the study was not done here in the United States. It was actually done in Asia in a population that has a higher risk of developing gastric cancer anyways. And so this begs the question, was it really the PPIs or these proton pump inhibitors that were the cause of development of the gastric cancer? Was it other factors? Was it the fact that they were smokers that were more likely to develop gastric cancer? We don't know the answer to that because that was not studied. Was it their diet that made a huge role with respect to developing gastric cancer? We don't know that. That was not studied in this particular study. Was it the fact that they may have been more obese? Could that have been playing a role in developing gastric cancer? Once again, we don't know that because that was not studied. The other concerning thing as well is that when you have a study that's done outside the United States, it's very hard to bring that information and to correlate it to our U.S. population here. And there are a lot of things that happen in other countries, different diets, different cultures, different pollution, different ways to do things. Smoking may be more prevalent or not as much prevalent. There are genetic factors outside the United States that play a role into developing of these cancers. And we don't necessarily have that here in the United States. And we know for a fact that for people born outside the United States who come here, they develop more American medical problems as opposed to the problems they had back where they came from. Same thing whenever we leave the United States as well. If we go to another country outside the United States, we pick up some of those medical problems that they may be having over there because of the environment and because of the things that we are exposed to at that other area. And so just because something had a possible correlation in another area does not mean it leads to a causation as well. The other important thing to realize is that there have been more and more studies showing that there's actually not been a risk of developing gastric cancer. And actually there was other studies that have been published which did not corroborate or did not confirm this particular hypothesis. And so we don't actually know if that's a real legitimate concern or not. And so these are a lot of just different factors up in the air which can confuse people. And so when you hear this headline of these long-term PPIs causing gastric cancer, it's very important to really take a step back and to understand, is this study true? Is it applicable to me? And are you yourself at risk for developing these complications? Now, having said that, we know that PPI is a very powerful medication to use. And we know that for a lot of people, it can cause some unwanted side effects, though there are important medications to take for other medical conditions. And so what should you do? What should you worry about? So number one, keep in mind that these PPIs have side effects. There's no doubt about that. There are side effects that are associated with taking these PPIs, whether it's a risk of developing problems with absorption of certain vitamins, a risk of having a higher risk for developing hip fractures if you're already prone to having that, whether there's a problem with developing C. difficile colitis or C. diff. There are significant risk factors that are associated with these PPIs, no doubt about that. The other important thing, the thing is I recommend for my patients is to start simple. You know, there are other medications, including the H2 antagonists, which I listed below. These are ones that you can get over the counter. They don't have the same side effects as the proton pump inhibitors, and they're very safe to take as well. And so they're perfectly fine to take if that's an alternative to help control some of your heartburn or reflux symptoms. The other options also antacids. Antacids are very safe, very short-acting, available over the counter as well. These are also very effective to hopefully allow you to control your heartburn symptoms. So the first thing is to start off simple. Try to do the H2 antagonist, try to do the antacids to see if you can control these symptoms. The other big thing that plays a huge role with reflux is lifestyle, and I tell all my patients that reflux is a lifestyle problem. The more you enjoy your life, the harder it's going to be to control your heartburn. And so doing lifestyle things can effectively help control the symptoms without having you to need to be on these medications. And weight loss by far is the most effective and the best way to help out with heartburn symptoms. And if you can lose even just a little bit of weight, you'd be surprised how much better not only will you feel, but your reflux will be as well. But also eating smaller portions is very, very important. If you stop eating about 3 hours before you lie down to go to sleep, that will help prevent the acid from going up into the esophagus, cause heartburn to occur. Raising the head of the bed about 30 degrees will also help out to prevent reflux from occurring. And stopping smoking is a significant improvement that will help out to prevent acid reflux from getting worse as well. So these are small steps that you can do for a lifestyle to help out with your acid reflux symptoms. And also have an honest conversation with your healthcare provider. If you are concerned about the side effects of these medications, speak to your healthcare provider. See if some of your concerns are legitimate or not, and talk to them to see if there's a possibility for a change. We want to always try to do the smallest dose possible. So if you're on a high dose of these acid-reducing medications, see if we can possibly back down on the dose to try a smaller dose to see if you feel any better. Also, it's very important to make sure you're taking the medication appropriately. What I mean by that is that there are a lot of people who get put on these medications who don't know why. If you don't know why you're taking Nexium, if you don't know why you're taking Dexilant, if you don't know why you're taking Protonix, ask your healthcare provider, why are you taking it? There are very few conditions in which you have to be on these acid-reducing medications. And so, if you don't fit those conditions, a lot of it is just based on symptom control, and there are other ways to control your symptoms. But have this honest conversation with your healthcare provider to see if that would be a good option for you. And keep in mind, even if you try all these things, there are other effective options to help out with your reflux. And this is a procedure that I do called the TIF procedure, or transoral incision fundoplication, in which we go down with the scope, we basically create a new valve. And for a lot of our patients who have chronic acid reflux, who don't want to be on any more acid-reducing medications, or who want to try to minimize the use of these medications, it's a very effective non-surgical way to help you lose the symptoms of reflux without the need of having to go through a major surgery. It's a very effective way for us to help our patients to control those symptoms. And if you're interested in this process, I would love to see if you can make an appointment with me to discuss this particular option. But there are things that are out there for patients who do have acid reflux, who don't want to be on medications or don't respond to particular lifestyle changes as well. So in summary, keep in mind, like any study that's out there in life, correlation does not equal causation. So just because one particular study just came out, showed a possible association between PPI use and gastric cancer, does not mean that it's the actual cause from that. Keep in mind, it was done in a different country. The study was not formed to actually answer that question. There are issues about demographics with respect to the patient population that was there. And also lastly too, there have been studies that came out after this which did not show a correlation between gastric cancer and long-term PPI use. And like I said before, if it's just been one study so far that's come out, beware of just one study. One study does not make or break the whole idea of what are causing some of these issues. But more importantly, the side effects are real for these PPIs. They are very powerful medications. They do an excellent job of controlling the symptoms of acid reflux or heartburn. Just make sure you're taking the appropriate dose at the lowest possible dose for the right reasons. And if you're able to do that, I'm pretty sure we're able to control your symptoms without the concerns about some of the side effects of these PPIs.